Minister, as I stand here, our people are waiting 3.5 years in acute pain for an orthopaedic appointment, a whopping 4.5 years for a respiratory appointment while we're in the depths of a respiratory pandemic. And appointments for services in the community aren't much better, with waiting lists of 2 to 3 years for occupational therapy appointments. Minister, we urgently need to do things differently and to address these appalling waiting times once and for all.
Thank you. Minister.
Thank you, Deputy. And I agree with everything you just said. So where do we start? We start as a Parliament and as a government by saying that the waiting lists before COVID arrived were completely unacceptable. They are higher now because of COVID and a cyber attack, and the current situation is completely unacceptable. So we have to act. It is my absolute priority as Minister, and it is a priority for all of the Ministers of Health here today in their respective areas. Right now we've got 760,000 patients on the acute hospital inpatient, day case, outpatient and GI scope list. There's a higher figure of about 900,000 often quoted, though this includes people who have appointments for scheduled care, cancellations and suspensions and so forth. However, on top of the NTPF list, as you rightly say, there are people waiting in the community. There's people waiting on mental health. There's people waiting on disability. There's people waiting on diagnostics. The situation is very, very serious indeed. At the beginning of this month, I published an acute waiting list action plan. The plan was drawn up between my department, the HSE and the NTPF. It's using the €210 million fund, the Access to Care Fund, that I allocated for this year to improve access immediately. The plan is to fund an additional about 150,000 interventions for people who are on those lists. And Deputy, as I know you'll appreciate very well, the waiting lists are continuing to rise. The no policy change numbers go up a lot. So the first thing we've got to do, even though we're dealing with a pandemic, even though we're dealing with a rise in COVID again, even though our hospitals are under pressure, is to stop the increase and then use every resource available to the state to bring it down. And I can tell you that all of the ministers here, all 4 health ministers, are absolutely committed in their respective areas to doing everything that can be done to get people the treatment that they need.
Minister, I appreciate your comments, and next year we'll spend €40,000 every minute on our health service. But we've seen in the past that just throwing money at our waiting lists doesn't work within our health service. And we need to see structural reform and not just reward those who work within our private hospitals. For example, in 2016, in the programme for government, a commitment was secured to look at expanding the Sligo Hospital cataract surgery model, which had slashed waiting times by providing the follow-up care in the community by ophthalmologists. 5 years later, the only expansion of that service has been to Letterkenny Hospital, where today just 32 people are awaiting cataract surgery. Minister, isn't it ironic that the two of the closest hospitals to Northern Ireland have slashed their waiting lists, and we have people from Munster having to travel as far as Belfast to get cataract operations?
Thank you. Minister.
Thanks very much, Deputy, for that. Money isn't the only answer, but it is part of the answer, because without money this is not going to move. Next year, I've allocated a total of €350 million. You'll be aware that I'm appointing a ministerial task force to look at this. We're taking the learnings from the very successful vaccine task force. We're bringing them to bear. We're going to do this differently, as you quite rightly say. We're going to use all of the capacity we can, first of all within the HSE, but then also within the private sector as well. €350 million is a lot of money, and it can do a lot of good. But I couldn't agree with you more. It's not enough, because using that kind of money can be effective in terms of dealing with the backlog. But what we've got to do is we've got to bring the capacity, the day-to-day capacity of our public health system up to a point where it can meet the day-to-day demand. Only then can we seriously talk about universal healthcare and exactly the kind of reforms you're talking about, including the cataracts model in Sligo, are needed.
I'll give you 2 other examples, Minister. Take the rapid access Hematura Clinic, the blood and urine clinic at Roscommon Hospital, where 10% of patients have been diagnosed with cancer. It treats 70% of patients in one visit. 100% of patients, that's all of the patients, are seen within the 28-day target time for urgent cases. And yet, this has not been rolled out anywhere else. If we look at the state-of-the-art theatre sterilisation room, constructed in 2016 at Roscommon Hospital, which has been storing beds and wheelchairs for the last 5 years because the HSE will not approve funding to equip the facility so that we could fully utilise the 2 theatres in that hospital and reduce waiting times across the West. But of course, if we did that and reduced waiting times across the West in relation to our waiting lists, that would undermine the case for the new elective hospital in Merlin Park. So it's better to spend money on treating patients in private hospitals than supporting public hospital innovation that can make a real difference in the long term to waiting lists.
Thanks very much, Deputy. If we're going to get this right, and we have to get it right, we have to be able to identify exactly the kind of projects that you've referenced. We have to replicate them and we have to scale them. All over the HSE, there are brilliant initiatives happening. In Tala, they've been running advanced nurse practitioner-led community teams in neurology, urology, various disciplines, and the results are spectacular. In fact, I may be wrong, but I'm pretty sure that the Sligo model you talk about is referenced directly in the programme for government. It's an example that I brought in to those talks, having met opticians and ophthalmologists in Wicklow who raised this exact one with me. We have to do things differently. We have to bring care closer to the patient. And when we see examples of excellence like you have just referenced, we are going to have to get better at replicating them and rolling them out across the system.
Thank you.